Hello, and thank you for joining today's webinar for parents on evidence-based strategies to prevent substance abuse, presented by the Office of National Drug Control Policy. In recognition of National Substance Abuse Prevention Month, this year's theme is Unleashing the Collective Power of Communities. Jamila Robinson will begin shortly as our ONDCP webinar moderator. We will first hear opening remarks from Michael Botticelli, Director of National Drug Control Policy. Next will be a keynote address by Dr. Wilson Compton, Deputy Director of the National Institute on Drug Abuse. Devin and Veronica Eckhart and Dr. Lonice Bias will then share their experiences as parents. The remainder of the conference call will have open lines for question and answer session. Dr. Compton will facilitate the question and answer session. Finally, Mary Lou Leary, the Deputy Director of ONDCP, will provide closing remarks. Now I will turn it over to Jamila Robinson, who will introduce the first speaker.
Great. Thank you, Marilyn. Good afternoon and welcome. I'm pleased to introduce our first speaker, Michael Botticelli, the Director of Office of the National Drug Control Policy. Director Botticelli was sworn in as Director on February 11, 2015, and has more than 2 decades of experience supporting Americans who've been affected by substance use disorders. Welcome, Director Botticelli.
Good afternoon, and thank you, Jamila. Thank you for joining us today for our Prevention Month webinar, and I'm really excited to be here this afternoon and to have the opportunity to speak with you all. Today's webinar will review evidence-based prevention strategies for parents and caregivers to prevent substance use. Before I hand over the floor to Dr. Compton, I just want to say how heartened I am to have so many parents, loved ones, prevention organizations participate in this webinar to recognize and kick off National Substance Abuse Prevention Month. I especially want to acknowledge the courage of 2 families who have agreed to be part of this webinar today, Dr. Lonice Bias and Devin and Veronica Eckhart. You have my personal gratitude for your efforts around prevention, and I appreciate you both being here today to join us. Next slide, please. The National Drug Control Strategy is the federal government's primary blueprint for drug policy in the United States. The President's science-based plan to reform drug policy includes preventing drug use before it ever begins. Preventing drug use works and is cost-effective. Our policies and public dollars can only go so far, however, and we need your help to address the nation's epidemic of substance use. Since the day I was sworn in as ONDCP Director, I have tried to be certain that I am focused on why I'm doing this job. I am working for you and the thousands of other Americans who have lost loved ones to overdose and have been affected by substance use disorders. I can think of no better calling. Your activism has been an enormous reason why we have been able to make so much progress at the national and state level on this issue. Although the federal government has a role to play, we know so much of what we talk about here requires collaboration with state and local communities. Today's presentation is about what parents can do to prevent youth substance use. We urge you to connect with your local prevention coalition or your local prevention providers. Become involved in your child's day-to-day activities and educate them about the dangers of using alcohol and drugs. We know that preventing youth substance use requires a comprehensive approach involving communities, schools, peers, families, coaches, faith leaders. All of these factors need to be considered as parents think about new ways to incorporate prevention into their child's life. Research indicates that parents are an influential factor in their child's use of alcohol, tobacco, and illicit drugs. Environment plays a key role, and we know that environmental strategies work to address substance use among youth, but neither can do it alone. Both are needed, and parental involvement is critical. Parents need to understand that they are an integral and effective part of substance use prevention. Parents must clearly express their disapproval of youth substance use and become actively engaged in the day-to-day lives of their children. Adolescents who have conversations with their parents about the dangers of substance use are less likely to be current substance users than those who did not have these conversations. Next slide, please. Next, I would like to turn your attention to one of the federally funded grant programs at ONDCP, the Drug-Free Community Support Program, or DFC. The DFC program provides funding directly to community-based coalitions to prevent youth substance use. Since 1997, DFC has been the nation's leading effort to mobilize communities to prevent drug use. We see a unique opportunity for parents to connect with DFC awardees and become involved in state and local substance use prevention programs. Prevention for parents means being involved. Parents play an important role in preventing substance use among youth. Talking with a child about the dangers of substance use and showing disapproval of such behavior is a key factor. Next slide, please. On our website, you can find a list and a map of all 2015 DFC awardees in each state. We will include the link to this resource at the end of this presentation so you can find out which DFCs are in your district. I strongly encourage each parent to reach out to their local DFCs and become involved in prevention activities and events in your community. Our staff can provide this information for you. So once again, thank you for participating today. We hope the information and resources discussed will inspire you to improve the quality and quantity of prevention programming offered in your state and community. Thank you very much.
Thank you, Director Botticelli. We would now like to introduce Dr. Wilson Compton, Deputy Director of the National Institute on Drug Abuse at the National Institutes of Health. Dr. Compton is a physician and the Deputy Director at NIDA and provides scientific leadership in the development, implementation, and management of NIDA's research portfolio. He also works with NIDA's Director to support and conduct research to improve the prevention and treatment of drug use and substance use disorders. Dr. Compton has achieved multiple scientific accomplishments. In 2013, he received the prestigious Health and Human Services Secretary's Award for Meritorious Service. Please welcome Dr. Compton.
Thank you very much, Jamila, and I'm so pleased to be participating in this launch of Prevention Month and to have so many people signed on to learn about drug abuse science and how drug abuse science can inform prevention is really a wonderful opportunity for me and for the National Institute on Drug Abuse. Next slide, please. A key lesson that we have learned from many decades of neuroscience research is that there are differences in the brains of people who abuse drugs from those who don't abuse drugs. This is at the heart of understanding addiction as a disease of the brain. So what you see in front of you are X-rays, are radiographs, PET images. PET images stands for positron emission tomography. So this is looking at, in a color-coded manner, the amount of blood flow in different parts of the brain. Red and yellow means a lot of blood flow, and blue or purple means much less. You're looking down at the head, so the top part, you see where that arrow is, that's towards the front of the head. So these are the frontal lobes. And if you notice on the left, a person labeled control has a lot of blood flow in the front part of their brain. This is the part of our brain that's essential for judgment and decision-making. How we navigate and mobilize ourselves in our environments is controlled by this part of our brain. Notice that a cocaine abuser has less activity in that part of their brain. Neuroscience is teaching us that these are not just abstract differences, but these differences play a key role in the way that drug abusers have trouble controlling their own behavior. But I think a key lesson here is that just like we can now use brain imaging to show differences between somebody who abuses cocaine and somebody who doesn't, this is just like we've done in other parts of medicine for decades. For instance, below you see a healthy heart with lots of blood flow throughout the muscle of the heart, and a diseased heart that may have had heart attacks and dysfunction like that shows much less blood flow. So this is a simple example of how neuroscience is giving us a glimpse of what we've known for a very long time, that the brain is impacted by drug use. Next. That's sort of a key introductory lesson, but one way to think about addiction, it's a combination of our innate propensity represented by our genes, what we inherit from our parents and our grandparents and our great-grandparents, all the way back for millennia. But it's not just the genes, it's how that innate tendency interacts with the environment. So it's not a simple story like the reason we have a certain color hair or other certain conditions, but it's the expression of addiction, the onset of drug use and drug addiction is a combination of those innate tendencies along with the environment. And the environment can be changed. That's where prevention comes into play. Prevention can shape the environment. It can shape it by changing the way parents interact with their children. It can shape it by changing the way schools interact with their students, and neighborhoods interact with the people that live in their communities. These are the places that we can make a difference to shape that onset and, frankly, to reduce the onset of drug use and drug addiction. Next, please. That's sort of our general lesson. Drug abuse is a disease of the brain. It's a combination of genetic predisposition along with environmental factors that remind us of the places where we can intervene. But another key lesson has been to understand who develops addiction and when does this happen. What you see in the top slide is something called a hazard rate. That means of those who don't have a disease, what's the chances of developing it at different ages? And DSM-4 abuse and dependence are the two psychiatric disorders that we commonly think of as addiction. Drug addiction, drug abuse and dependence, develops typically during the teen years. It rarely starts before about age 12 or 13, and it typically rarely starts after about age 25. So that tells us that there's something unique going on in the brains of adolescents. I think all parents understand that there are unique behaviors that adolescents engage in. This is a time of life when they are primed to be exploring the environment, to try out all sorts of things outside of the home and outside their normal daily lives. That puts them at risk, whether that's due to exposure to drugs or driving fast or doing all sorts of things that we know are a risk for teenagers. That exploration is also part of growing up, and so it's a fine line between trying to encourage exploratory behavior, exciting new opportunities, as well as making sure that we keep our kids safe from the dangers that might exist in the environment. What you see below are how the brain matures across development. And it's interesting that the development proceeds from back to front. And you may remember that I mentioned that the front lobes are where judgment and decision-making, executive control are located. Those are the last parts of the brain to develop. So perhaps that helps us understand why teenagers have difficulty in controlling their own behavior. Particularly in emotionally charged environments, they have difficulty saying no. They have difficulty resisting temptation. And yet those pathways may be strengthened by that time they hit their mid-20s. So in some ways, it's a matter of parents keeping their kids healthy and safe for about a 10-year period of time, the period of most risk. Next. It's not just the teen years, but we know the roots of addiction start much earlier. So some of the behaviors and some of the trajectories can start very early in life. There's a remarkable study that has shown us that early childhood experiences, whether that's abuse, neglect, or trauma, can increase the chances of becoming addicted. So for youth that have, compared to youth that have no exposure to any of these negative early childhood experiences, those who have 5 or more are almost 9 times more likely to have addiction when they hit their teen years or adult life. So this tells us the importance of early childhood experiences. Next, please. This is at the heart of what we've learned about prevention. And prevention science is teaching us that these interventions can have long-term effects on drug use and abuse. Next. Director Botticelli already showed you this slide, but I highlighted for you to remind us that the way we conduct prevention is to try to reduce risk factors. This might mean reducing the amount of drugs available in a school or an environment. It might mean helping children who have difficulty with their social skills or difficulty with being particularly aggressive. We know those are risk factors for later onset of drug use, and these are things that can be changed with interventions. We can also enhance protective factors, enhance parental monitoring. Parents can learn to keep a closer eye on their kids, to learn who their friends are, and to set firm rules and limits. They can also learn to create a very positive, loving, and nurturing home environment. Those are sort of the key factors when we think about family interventions. Next, please. One way to think about the interventions are, there are many things we can't change. We can't change your genetic background. We can't change how old you are or your gender. We can't change your poverty level, at least within most realm of interventions, although I do pay attention to some of these as being even potentially modifiable. A key A key factor is that there are modifiable risk and protective factors. We can intervene using parent skills training, social skills training, tutoring even, norms training. These are all proven programs that science has taught us over the last 20 to 30 years can make a difference in keeping kids healthy and safe. Next slide, please. Here's an example of an intervention that takes place during the prenatal years, during pregnancy, and the first 2 years of life. I think it's remarkable that something that takes place that early in life can really shape a child's trajectory. This probably doesn't surprise any parents. They know that how we take care of infants makes a huge difference in their growth and development over the ensuing decades. But what's been important is that for high-risk families, these are particularly proven for teen parents and others who are at risk for having difficulty being parents, that sending a nurse in to work with them during pregnancy and during the first 2 years of life can make a remarkable difference in how they take care of their child. It can reduce child abuse and neglect early in life, and even later on, it can make a long-term difference. Look in the upper left-hand side. Those who got the nurse to come to their household when they were very young were much less likely to use tobacco, alcohol, or marijuana when they reached age 12. That means the intervention took place 10 years ago, and it's still showing a difference. It's not just substance use, though. These interventions play a role on many outcomes. They reduce the onset of depression and anxiety. That's internalizing problems. They help the academic performance, so they do better on reading and math scores when they start out with a positive, nurturing relationship with their mother during their first couple years of life. It even may play a role in whether the mothers themselves suffer difficulties, so that being a more effective, successful parent seems to be protected for the mothers. So 12 years later, the mothers who participated in the nurse-family partnership intervention were much less likely themselves to have alcohol or drug problems compared to those parents who didn't have that opportunity. Next, please. I think this shows us the example of how prevention can produce long-lasting effects. What I have for you is a population study. So this is different. This is the PROSPER. It's a community-university partnership that has been shown in a study of 26 communities to compare communities that had this partnership program to help their communities organize and implement prevention, that they show better outcomes over time. That's the blue line compared to the red line over time. So this is an intervention starting in 6th grade, and it typically included a family intervention where there was training of parents on how to supervise better and also how to provide a loving, nurturing environment. And that indeed, when we provide those interventions and help parents learn those skills and help the kids learn better skills as well, that they are less likely to go on and have drug problems over the ensuing years. What's remarkable to me is this can impact the entire population. So this wasn't necessarily those who participated in the intervention. This was the entire community that was studied in this project, showing that in this case, over the ensuing 6 years, they can still show a difference. Next, please. It seems to show the biggest impact on those who were most at risk. So when we look at those who were at high risk, those are the top 2 lines, the differences are greater. So just as we would hope, those youth and those families that are most at risk for the onset of drug use really show a greater benefit from this family and community-based intervention. Next slide. An interesting question is, what about the fact that not everyone participates in these interventions? You know, when you go to a school and you start an after-school program, only some parents will show up. In the case of this PROSPER study, it was about 20% of the families who were eligible that came to the intervention. I would have thought that it only had an impact on 20% of the kids. It turns out that when a youth knows lots of other children that participated in that Strengthening Families program, that it has a positive effect. So there's a social network effect. That means the benefits of these programs spread beyond the individuals who are involved. So when you're developing your community-based intervention, when you're working with coalitions and with families You may not reach everyone in your community directly, but indirectly you're reaching a tremendous number of people. And we see this by the fact that having more friends who participated in these interventions was positive. So even if the individuals didn't participate, having a lot of friends who did seemed to make a big difference. In this case, when it came to smoking cigarettes or drinking too much. I think that's a terrific example of how there may be unanticipated benefits of these community and family interventions. Next, please. We also see that these family-based interventions can have long-term effects outside of their main target. These were implemented as drug abuse prevention. But what they show is that this intervention was implemented at 6th grade. That's the green box. We show that it has an impact over time in the parenting skills and student substance abuse risk right away, right in the 6th grade. It shows greater school engagement by the 7th grade and 8th grade. And what we see is by the 12th grade, this family intervention, this community-based family implemented intervention in the 6th grade can improve the academic success, graduation from high school, and greater success in school. So not only do these interventions improve drug use outcomes, but they also help you do better in school. That's a win-win for everybody. Next, please. Now, I provided for you just a couple of examples of how family and community-based interventions can make a difference in the lives of children. But let's talk about three key examples for you about problems that are taking place right now in communities all across the country. First, I want to focus with you on prescription opioid misuse. This relates to the recent increases in heroin that we're seeing in so many parts of the country that are so disturbing and so concerning to many of us. Next, please. What we've seen with prescription opioids, these are the painkillers like hydrocodone or oxycodone, Demerol, Darvon, Dilaudid. These are just a handful of the names of the chemicals that fall into this broad category of prescription opioids or the prescription painkillers. What we've seen is a remarkable and, frankly, a concerning increase in the number of prescriptions written for these. Right now, the United States consumes something like 75 or 80% of the world's narcotics. What's our population in the United States? It's about 5% of the world's population. I don't think we have 20 times the pain in this country that would require that amount of opioids. But what we've seen is physicians relying much more frequently on a prescription pad for opioids, for painkillers, rather than other approaches that might reduce the severity of pain or might produce positive outcomes. What we're seeing is that there are well over 200 million prescriptions. These aren't tablets. These are prescriptions. That's enough prescriptions for every person in this country over the age of 18 to have one prescription every year. I think that's astounding that we have that many in terms of the broad environmental availability of these substances, some of which will be diverted and lead to very, very negative outcomes for so many individuals. Next, please. What we see in this chart is a very dry set of numbers. What you see is a blue line that represents the opioid sales. So these are the increases in the number of prescriptions written in our country over the last decade. What we see in green are a parallel rise in the number of treatment admissions related to opioid disorders, prescription drug addiction, and heroin addiction. So as we've increased the availability of these prescriptions, we've seen a corresponding increase in the people ending up getting in trouble with them, ending up addicted to them. But perhaps most concerning, absolutely most concerning, is that we see a parallel rise in the number of deaths related to these opioids. So as we've had greater availability in our communities, we've also had a greater number of deaths. Now on the right, what you see are the overdose deaths related to drugs. And I use the term overdose in a very general way. This means any unintentional death caused by a drug. And you're going to hear some very sad stories from parents in just a little while about how each one of the numbers, that's 44,000 people dying in 2013 from one drug or another. That's the equivalent of about 2 747s crashing every week in our country. That's an astounding number of deaths Each one of those deaths represents a family tragedy. Each one of those individuals had parents, had siblings, may have had children, and certainly had loved ones in their lives that grieved their loss. That's what motivates me every day to try to do a better job of addressing this epidemic, try to draw attention to it, and try to see what we can do to equip parents and communities to do something about this dreadful problem. Next slide, please. Now, what I've been talking about, there's a sense that it's the prescriptions themselves that may be related to the harms. But there's a really important set of information that comes from this survey that's been done by SAMHSA, the National Survey on Drug Use and Health. What you see on the left is where people got their last pill. These are people that misuse, abuse these prescription pills. Where'd they get them? On the upper left, you see that they get them maybe from one doctor, 17%, or from multiple doctors. Some of us think of that as doctor shopping. That's about 2%. Where are most of them getting their pills from? Most of them are getting them from their friends or relatives. So that tells me something important. It's not the patient to whom I write the prescription directly who's at risk, but it's their family, friends, their neighbors, and their community who are also at risk. And indeed, it's not doctor shopping or problematic prescribing. It's often just one doctor writing a prescription for that injury you had that took you into an emergency room. Or after surgery when you get enough pills to last you a month and you only need them for 2 days. These are examples of how we might be able to reduce the excess availability of these pills by addressing how doctors are writing their prescriptions. You hear that I'm suggesting to you some of the interventions we might consider. Next slide, please. I'm going to highlight for you one prevention intervention, and we'll come back to that in just a minute. But as a country, we are really doing the best we can to get in front of this devastating epidemic. We are focusing on less abusable painkillers. Are there ways that we can at least make it less likely that people will snort or inject these pills? After all, that's the route of administration that is most risky. It can be very dangerous to take them by mouth, but particularly when people are resorting to injecting them or snorting them, that's a really bad and dangerous warning sign. We're working on direct overdose interventions. So we'd like to see every person who's at risk have their loved ones have access to naloxone. That's an opioid antidote, so that if they are found to have overdosed, they can be resuscitated and brought back to life, so that there's an opportunity to then guide them towards more safer and better decision-making over time. We certainly see a need for not just the overdose intervention and not just the prescribing changes, but also access to better addiction treatment. So we need to treat the underlying opioid addiction, whether that's heroin or the prescription opioids, more effectively with better access to treatment all across the communities in our country. And finally, you've heard me already mention how clinicians play a key role in this. So we see clinician education, changing prescribing practices, and educating the public to demand these changes both in their community responses and in the clinicians in their communities to be essential towards doing something about this epidemic. Next slide, please. Now, in keeping with our message today, what I've highlighted for you is another example of that Strengthening Families program. This is a middle school intervention that was designed to help parents provide nurturing environments and supervise their teenagers better. It really wasn't designed to address prescription drug misuse in any direct way. But what we believe is that these kind of interventions, when delivered to parents of middle school kids and to the middle school kids themselves, can provide a protective shield for these youth. Indeed, there are now 3 studies that suggest this protective shield, when provided during middle school years, can help save the lives of individuals when they reach their 20s, can make them less likely to misuse opioids, the prescription pills. So let's look at this data. Those who didn't participate in the intervention had about a 15% chance of misusing one or more prescription drugs, or a 13% chance of misusing the painkillers, the opioids themselves. Those that participated in the family program were about a third, had 1/3 the chance of that. So about 5% exposed to any of the prescription pills and under 5% exposed to the painkillers, those that are associated with the vast majority of those overdoses and deaths. So to me, this tells us the unexpected value of these family-based and community-organized prevention interventions for whatever epidemic we see in future years. Because right now we're focused on the opioids. If I'd spoken to you 6 or 7 years ago, it would have been methamphetamine. I don't know what the epidemic will be in another few years, and so these broad-based universal prevention interventions might be there to help our youth no matter what they face as they grow up. Next slide, please. What we do see is that when communities implement a widespread set of interventions, it can make a difference. So Staten Island was experiencing a tremendous epidemic of overdose deaths. They implemented prescribing guidelines, public announcements, the prescription drug monitoring laws, emergency department guidelines, public meetings, and more PSAs. And over time, what they saw was an improvement in their overdose rates. Next slide, please. More dramatically, the state of Florida, which was at the epicenter of the excess availability through pill mills and through really rogue medical practices in many parts of the state, that when they implemented important laws around that affected the pill mills and rogue pain clinics, what they saw was a marked reduction in the number of deaths due to oxycodone, Xanax, that's alprazolam, methadone, or even hydrocodone deaths. Interestingly, when they saw those improvements in the overdoses from those prescription drugs, they did not see an increase in heroin deaths. So that's good news, that we really can potentially do a good job with policy and environmental strategies that can help to save lives. Next, please. Now, I don't want you to think that we've addressed this problem adequately, because we certainly have not. We have seen a slight leveling off in the number of deaths related to prescription opioids. They've been about the same for the most recent 3 years of data, 2011, 12, and 13. But at the same time, due to the huge number of people that developed a taste for opioids and the excess availability of heroin in so many of our communities across the country, we've seen a skyrocketing increase in heroin deaths, where heroin deaths have about tripled in the last 4 years and now number some 8,000 in the year 2013. This is, I'm afraid we're not in front of this epidemic, but this is one where we really need to figure out smarter, faster, and better approaches. Next slide. What we see just 2 weeks ago in data coming from the National Survey on Drug Use and Health is that the number of persons reporting heroin use at any time during the past year has again continued to markedly increase. So there's some 900,000 individuals ages 12 and older that use heroin in the most recent data. That's a terribly concerning number of individuals potentially who are at risk of dying of overdose, and certainly the devastation on themselves and their family is hard to fathom. Next slide, please. Okay, I've started with one end of the spectrum. I want to point out to you a new set of issues that we're just beginning to understand and are raising tremendous concern. So we talked about the opioids, talked about some general principles of prevention, now the opioids. Now I'd like to talk to you about a new situation which are affecting youth in our country, electronic nicotine cigarettes. Now I think these may have some promise for helping confirmed smokers switch to something that almost certainly has less harmful constituents. It is made from tobacco products. It does include nicotine, so I can't say that it's completely safe, but it's delivering nicotine by basically using a battery and a wire to boil the liquid and produce a vapor that is then inhaled. That's very different from burning tobacco, which produces hundreds or thousands of carcinogenic compounds. So I do think that there may be some promise for confirmed smokers. But the real risk is for people who aren't using, and that includes youth in our country. Next slide. What we saw last December was our first data coming from the Monitoring the Future study. This is an annual survey of 8th, 10th, and 12th graders that really alerted us to how frequently e-cigarettes are reported by teenagers in our country. E-cigarettes are now reported by more youth in our country than combustible tobacco products, than tobacco cigarettes. Let me say that again. There are more kids using these e-cigarette products than regular cigarettes, than combustible cigarettes. That really surprises me. I think it speaks to the curiosity of kids. They see a lot of advertising. They see other people using them. They're curious about them. Now, the real question is this part of just a passing fad, in which case that's typical for teenagers, or is this something that will be the start of a long-term trajectory of a life-threatening addiction? Next slide. Some of the early evidence suggests that it's part of a pathway into tobacco addiction. There's now one long-term study that shows over the ensuing 2 years, a number of youth that use e-cigarettes will begin to use combustible tobacco. Even in this study out of Monitoring the Future last December, showed us that a large number of those kids who were using e-cigarettes had never used other tobacco products. So these weren't former cigarette users who were trying e-cigarettes. This was their first exposure to nicotine. So a devastating addiction to nicotine can start with e-cigarettes now. I haven't even mentioned the fact that these devices might be used for administration of other substances. We're certainly seeing on the internet and from reports from many youth about their use for delivery of marijuana or marijuana oils and so forth, and we certainly are hearing stories about them being used for other psychoactive substances, for other dangerous substances, using this to inhale them. Next, please. I've highlighted for you the opioid situation very briefly, which has galvanized an awful lot of attention. I've talked to you about e-cigarettes and electronic delivery systems. Let's talk very briefly about a third situation that's impacting all of us. It's the shifting marijuana environment. Next slide, please. What we've seen is that the laws are changing around the country. Oregon just recently started selling, I think last week or the week before, just started allowing the retail sales of marijuana. So joining Washington State, Colorado, Washington, well, not D.C. it's legal in D.C., but there are no sales facilities in D.C., and Alaska as facilities that allow the sales for retail. But then there's also widespread availability through medical marijuana. The impact has been to change the attitudes and norms related to marijuana, and this is a great concern. What we see in youth in our country is that more kids are using marijuana than tobacco products. We've seen remarkable improvements over the decades in use of alcohol and in cigarettes. Cigarettes are now used by fewer youth in America than we've ever seen in any data collected. But marijuana has been going up. That's why we're so concerned about it. Next, please. As we see changes in the attitudes, we see changes in behavior. So we've seen improvements in the number of kids reporting driving after drinking alcohol, but no such improvement in the number of kids reporting driving after smoking marijuana. And there's many studies to show us that it is not safe to get behind the wheel of a car after smoking marijuana. Next slide, please. A related concern is that marijuana today is quite different. The potency is much higher than it used to be. Next slide, please. I've also highlighted for you that the attitudes towards marijuana may have been changing because of the increased availability and the sort of social attitudes. This is reflected in teenagers. They are much less likely to report that they see smoking marijuana as risky or dangerous. Next slide. Now, is that just a general phenomenon, or does that matter? I want you to look at this slide very carefully. What you see in red are the attitudes towards marijuana, the perceived riskiness. What you see in green are the rates of marijuana use every year since 1975. They look like a mirror image to me. So what we see is that as perceived riskiness, as the attitudes towards marijuana either increase or decrease, we see a corresponding decrease or increase in the use of marijuana. So when people wonder whether the attitudes more towards marijuana matter, I would use this study to suggest that they really do matter, that we see a strong correlation over time. And so we need to keep an eye on use of marijuana because given the deteriorating attitudes, we might see market increases over the ensuing years. Next slide. Regular use of marijuana has been associated with very negative outcomes, and I'll highlight just a few of them for you in the next couple of slides. Perhaps most concerning, a long-term study out of New Zealand that followed individuals from birth to now age 38 demonstrated that those individuals who used marijuana during their teen years and continued to use during their 20s showed a reduction in their IQ. That means their brain wasn't working as well when they continued to use marijuana regularly and frequently over many years. So it tells us that particularly the heavy regular use is a marked concern. Next slide. This is also shown in multiple other outcomes. These are 3 large-scale population studies that our colleagues down under in Australia and New Zealand conducted. They've been following individuals that used marijuana either never, rarely, weekly, or daily. And OR stands for the odds ratio. So compared to those who never used marijuana, on the left you see high school completion. Compared to those who never used marijuana, those who used daily were about 30% as likely to graduate from high school. That means they are much more likely to drop out of school before completing. Looking at the bottom, you see that they are much more likely, about 18 times more likely to be dependent on marijuana. They are about 7 to 8 times more likely to use other drugs. And perhaps most frightening, they are nearly 7 times more likely to attempt suicide by the time they get to their mid-20s. So marijuana is associated with educational outcome, with drug use issues, and even with mental health problems. Next slide. What's been of greatest concern, or among the great concerns, has been the relationship to schizophrenia and chronic psychosis. A very important study coming out of Sweden took advantage of the fact that the Swedes keep very careful records that researchers are able to look at. And what they showed is that even among those who are genetically identical, those would be twins, monozygotic twins, identical twins, using marijuana puts them about 2 times as likely to develop schizophrenia over the ensuing 7 years. So that suggests to us that it's not the genetic predisposition, it's not some other factor, but that marijuana itself may be dangerous and detrimental to brain functioning, structure and functioning. Next slide. We have a surprising amount of information on these issues, but we need more. We have some studies, but we certainly need to really understand how much are these differences that we see in marijuana users compared to those that don't use marijuana due to factors that may already be there at birth or during childhood, or is it really due to the exposure to marijuana? This is very important to our policy and practice environment. So to help with this, NIDA and other partners at the NIH have just launched a very large-scale study to understand what happens to the brains of children who will be studied prior to their use of drugs at ages 9 and 10, and then we will be following them up during their teen years to understand what the impact of alcohol, tobacco, and other drugs is on brain structure and function, their psychological functioning, and their educational attainment over time. This is the kind of study, the landmark study, that NIDA and the NIH need to do to help us inform the communities and prevention practices of the future so we can do a better job of improving the lives of youth all across the country. Next slide, please. I'm wrapping up now, and I want to end just by, I hope you found that I was able to demonstrate for you that neuroscience and basic sciences indicate the importance of development and provide some background for prevention, intervention, development. But it's not these sort of abstract ideas that are so important. It's the number of people impacted by drugs today, whether that's the overdoses and the drug-related deaths we see in so many individuals and so many just such sad cases from all across our country, or the new onset of electronic cigarettes and use of these devices for other drugs, or even the problems related to marijuana and the changing social environment related to marijuana. These require creative and vigorous responses from everyone listening on the phone and the communities that you represent. Thanks very much for your attention. We'll have a chance now to hear from parents who were involved, and then we'll open it up for some questions in just a little while.
Great. Thank you, Dr. Compton. As Dr. Compton mentioned, we would now like to introduce our parent panelists. We have Dr. Lonnie Bias and Devin and Veronica Eckhart. After hearing their personal stories, we will open up the lines for questions. At this time, I'd like to briefly introduce Dr. Lonnie Bias. Dr. Bias is a known speaker, trainer, and consultant, and also a certified teen and family life coach. Her journey was navigated as a public speaker after the death of her son, Len Bias, a University of Maryland basketball player. Dr. Bias, I'd like to turn it over to you now and ask you to share with us your personal story and how you became involved in substance abuse prevention.
Well, I became involved in substance abuse prevention, being kicked out of my comfortable position. We live the good life. The good life are families that are doing everyday life, working, parents working, dealing with the children, all of the different activities that involve family life. That's what I call the good life. And then Len was playing ball. My younger son was playing ball, and we were involved in all of these activities that were built around sports. The second part of my life, that was the good life, and then we have the nightmare. And the nightmare comes in life when you receive a telephone call that you do not want. And what we received on June 19th, 1986, is that Len was in the hospital ill at that time. They had taken him to the hospital. We did not have any idea at that time what the problem was. We received the call, my husband and I, 6:30 a.m. that morning. We proceeded to the hospital to find his teammates there from the University of Maryland and the media, so many people there. And I asked them what was going on, and they said that Len had gotten sick and that they had brought him to the hospital, and we couldn't figure out what could have happened in between him being drafted by the Boston Celtics 24 hours before, and now he's sick. Later to find out that Len died, the doctor came to Leland Memorial Hospital at that time and said that Len Bias was dead. That was the nightmare. What accentuated the nightmare even more is later that day, a detective came to our home and sat on my sofa and said that Len had died of cocaine intoxication. And I was astounded and shocked at that time of his death, because the teachings that my husband and I had given at that time, the type of home we came from, the type of home that he was raised in was not a perfect home, but we believed in good character and moral values, and many people that knew Len said that he exemplified. Well, I thought I would die, and out of his death, the third point in our life came life after death, and that was trying to put the pieces back together again after Len's death. That was very, very difficult because we had 4 children. One was dead. The entire nation was grieving, anyone that was in sports, so you can imagine what our family was going through. And it was such a tragic and very difficult time, and we were struggling to put the pieces back together again. Out of Len's death, a mission, I felt that it was a God-given mission for me to go out and to speak about drugs. And so we had the good life, the nightmare, life after death, and now we're in a place where the best is yet to come. And the mission was born to go forth and to strengthen families, to teach young people and the community about the difficulties of substance abuse and using good prevention ethics in order to bring change within our community. But unfortunately, Len has been dead 30 years, and we're still having the same conversation. Something has to change.
Thank you, Dr. Bias. Can you share a little bit more on your mission and your focus from this point on, and why you've been involved in youth substance abuse prevention?
Well, I'm a firm believer that our young people in this nation are reachable, teachable, lovable, and savable. We must change our approach in adapting to their needs. What worked in 1986 won't work in 2016. Well, what worked in 2014 won't work in 2016. As we see the progression of everything technologically, in terms of the iPhones and even the way we're using this mechanism today, a webinar, we're having a webinar with so many participants involved. Everything has progressed except for our strategies in saving our young people. They are reachable, teachable, lovable, and savable, and I believe the best is yet to come for them, and they are this nation's greatest natural resource. So I believe that we have to work harder and smarter. I believe that they can be reached, but we must change our approach in adapting to their needs.
Thank you. Can you also share what are some of the things that you wish you were aware of before this life-changing event?
I had no idea how important prevention was. I will mention to parents that I believe today you have to pay attention to who your children are associated, who their associates are. And I believe that Len Bias is dead today because of his choice of associates at that time, the people that were in his realm of influence. I'm not blaming them. I'm saying that if you are going to have an opportunity to catch your dream or to accomplish a dream, you have to be around people that are supporting that dream. He had people around that supported him that way, but you can't go back to the other side with other people that are not thinking the way you're thinking. It's important to keep children in the straight and narrow and to keep covering them no matter how old they are and continue to strengthen them. I now have 5 grandchildren, and I am very strict on them. I love them very well, but I'm very open with them. I have lost 2 sons, Len to drugs and Jay to violence. 4 years later, my son Jay. So I have 5 beautiful grandchildren, and I don't waste encouragement. I don't waste the time that I have with them by not encouraging them and telling them the best is yet to come. And their parents, my daughter and her husband, cover their children. They're not perfect children, but they cover them, and they're there to lead, guide, and direct them because we have drank from this bitter cup as a family, and so we are working very hard within our family with our 5 grandchildren to make sure that they will steer away from those things that will. Now, are they perfect? No, they're not. They're children, and some of them are young adults, but we still talk about the importance of who you're around, who your friends are, and to be very careful when you're out. If you're drinking, don't put a glass down and leave it. That's very important today because on our so many different communities, on college campuses and different places where young people are socializing, the kids will spike the drinks with something. And it's very, very important, the preservation of their lives, taking good care of their lives and not leaving their lives in the hand of someone else.
Thank you. And then if you could just share a few tips and strategies on what you think you can do to possibly help other parents.
As Dr. Compton said, I thought your presentation was excellent, just absolutely excellent. And one of the points that you made is the first point that I have here in my notes is, and that's parents must understand the stages of adolescent development to better cover them. From the time children are born, when the terrible twos come, the brain is developing and they're preparing for independence all of the time. By the time they get 10 or 12 years old, they want to shut the door. They don't want you in their space. All of this is normal, but we will tend to put negative terms on it rather than it's something normal, and parents not to be shocked by it, but to still cover and guide and do the things that you need to do to lead them, as Dr. Compton said, into paths of wellness, into a well environment. And no matter what young people are going through out in the community, their home should be a place of peace where there can be reconciliation. They can sit down and talk to their parents and share, have good family time together. And as I said before, there are no perfect moms, dads, or families anywhere. The Joneses look like they have it all together down the street. You go down there, they're jacked up too. Everybody is trying to make it. That's what I have found out. And also, parenting is absolutely exhausting. And we have too many parents ready to throw the towel in, but we have to work harder and smarter to save this nation's greatest natural resource, our children. And I also very quickly tell would share with parents to develop good communication, as Dr. Compton said again, and relationships starting at a very early age. You can't wait until your child gets 15 years old and you see everything that's there out there that they're exposed to, and then you want to try to train them. It's not going to work. And also, parents, do not be afraid to enter your child's culture. So many, the greatest problem that we have today is that so many parents are in denial. Don't be afraid to enter the culture so that you can better understand this culture and the challenges your children are confronted with so you can help them through. Your child needs you to survive. Parenting is exhausting, but we must continue to cover, lead, and guide by good example our children to places in safety. And finally, my last point is this. Parents, schools, and community, as Dr. Compton said again, must be actively involved with developing new strategies of prevention and substance abuse. As I said before, what worked so many years ago will not work today. Nancy Reagan's program, when Len died, it was Just Say No. And there was so much funding thrown into that program, and we sowed a lot of seeds and did a lot of work around that time. But that program 30 years ago won't work today. And the work that we need today is we need all hands on deck. In the family, as Dr. Compton said, in the community, in the schools, we need everybody to help today. There are many paths to the top of the mountain, but once you get there, the view is the same. And what we're doing here today is one path, but there are so many other paths where people can work to save this nation's greatest natural resource, our young people. Thank you.
Thank you, Dr. Bias. Thank you so much for your warm remarks. Again, I'd like to now turn it over to my other parent perspective, the Eckharts, Veronica and Devin Eckhart. They founded the Connor Project Foundation, where they dedicated their lives to raising awareness about the widespread availability of synthetic drugs. They've been working to change policy so that not another family has suffered it. I now turn it over to Devin and Veronica, and I offer you the same question. If you could please share your story and tell us how you became involved in substance abuse prevention.
Thank you so much. The Connor Project Foundation believes that every life matters. And this is Veronica Eckhart, and you'll hear from Devin next. We're going to talk about something called new psychoactive substances, also known as Spice or K2, many actual names out there for it. These substances are used at a very young age, and they are marketed to our children. These substances can also be purchased at corner markets, convenience stores, some gift shops, some bait shops, gas stations, bodegas, and there are over 1,000, maybe more, entities online where they can be purchased. Our son, Connor Reed Eckhart, who was 19 years old, was hospitalized directly after a family beach vacation that we took with his two sisters, Ashnika and Sabrina. During that time of our vacation, there was absolutely no sign whatsoever that there was going to be any use from Connor of a substance, as we call it, Spice. We left Connor 4 days after our vacation, and we also received a call. We received a call that our son was in a coma in the hospital and that we needed to come immediately. At this time, the hospital and the doctors would not tell us what was going on. It took us 14 long hours to reach our son. 14 hours of wondering and waiting if we would see our son alive. When we showed up at Hoag Hospital in Newport Beach, the doctor met us there at the neurointensive care unit and told us that our son had ingested a singular hit of a new psychoactive substance, as we call spice. Devin and I were not parents that had our heads in the sand. We had heard of many different types of drugs. We were not a family that was broken. Matter of fact, today Devin and I celebrate our 25 years of marriage. We were close. We communicated. As I said earlier, there were no signs. Connor had been offered the night before a drug, an illegal drug, that he said no to. And then he was offered something that was purchased at the corner market, a new psychoactive substance that he said yes to. He took one hit, didn't feel well, laid down. His friend that he was with never ever checked on Connor for 11 hours. By the time the ambulance picked Connor up, he was already blue. When we saw our son lying there with tubes and machines going and nurses working frantically around him, we looked at the doctor and we told him that we want to share our story. And while our story began to become shared through social media on the Connor Reed Eckhart Facebook page, thousands and thousands of people from all over the globe started reaching out to us, asking us for help. And it was during this time that we realized something needed to be done, something needed to change, and people needed to be educated. That a decision to use something one time can change your life and your family's life forever. We had 4 days with our beautiful son in the hospital, 4 days to remember every part of him. Connor was an organ donor, and he gave life to 4 other people. From this experience, the Connor Project Foundation was formed to educate, build awareness, and prevent this happening to another family.
Thank you, Veronica. If you could also share with us, from your perspective and your work that you've been doing in these last few months, what are some of the things that you wish you were aware of before you and your family's life-changing event?
This is Devin. We didn't really know anything about these new psychoactive substances. We, as Veronica said, we were not parents who were naive. We had had conversations with our kids on many occasions and tried to inform them. We were very aware of who they were hanging out with and what was going on, and yet still we were not aware of NPSs and, more importantly, just how deadly and dangerous they were. I think it's shocking that things have changed from the days when we were growing up, where access to drugs and to opiates and to substances that are mind-altering and are dangerous are now so readily available. It doesn't require a drug deal under the bridge or in the back alley, but you can go to a local market or store. As it's already been outlined, the opiates and prescription drugs are available in abundance from friends and in people's homes, and there's not the right kinds of conversations going on about the dangers and about the substances.
Thank you, Devin. If you or Veronica could share, what are some helpful tips or strategies that you'd like to share with parents to help support their children, some of the things that you have learned?
Well, I think first of all is many of us, as we get older, get afraid of what is out there, and we feel that if we don't mention it, it's not going to happen. We speak at many schools and different functions, and there's a great number of schools that actually do not want us to come in with the message because they're afraid if the kids hear it, then they're going to do it. We don't believe that. We believe that you have to educate your children. You have to get into their world. You need to know how to work social media, Twitter, Instagram, Facebook, chats, all the different ways that they communicate. We have to understand that children take in messages in 5 seconds, 10 seconds, 15 seconds, and sometimes that's all you have when you want to reach them. That is why social media is a huge way that the Connor Project Foundation works. I would also say that single decisions can change a life. Don't blow off subtle signs or not so subtle signs. Many times people will tell you, oh, that's just a teenager. But if you notice that your child is sleeping more or sleeping less or eating more or eating less or their grades are slipping, get into their world. Start asking questions. Speak to their teachers, their peers, their friends' parents. Ask them if they've noticed a difference. I would also say that if your child is struggling, take it seriously. Do not wait. Get them help immediately. A one-time or one-week addiction can turn into a 10-year addiction. I would also say that speak to your children often. Take these new psychoactive substances, whether it's that or opiates or prescription drugs, seriously.
Kind of on those topics, I'd add that as we've gone out and spoken now many, many times, what we find often is that when we're, for instance, in a large school setting and you ask young people, how many of you are aware of things like Spice, K2, these new psychoactive substances, most of the hands in the room will go up. They're aware of them, and they think they know what they are. The reality is that if they're aware of them, they're grossly misinformed about really the dangers of what these substances are. And conversely, when we talk to parents and we ask them that question, very few hands go up in the room. So there's wrong information and lack of information of what's really out and in the forefront of our young people and our youth. The fact that these are available in liquid form has been, as it's been mentioned, makes this particularly scary. We've met a number of families who have lost children and loved ones or have suffered severe side effects and impacts because their loved one or their child was given this in a drink when they didn't know they were going to get it. A friend gave it to them, and with kind of the either passing it off in a drink or in an e-cigarette to watch them get high, or because they just didn't care to tell them that it was in there, and then all of a sudden you've got a very scary situation. So educating parents, educating youth is critical. And what we found is that Connor's story is not unique. Unfortunately, there have been a lot of youth who have suffered kidney failure, ongoing psychotic breaks, and death like we have experienced. And yet, for some reason, his story is unique in how it has captured the hearts and minds of people literally around the globe. And what we've realized is it's not just information, but you have to capture young people's hearts. And parents are using his story, his Facebook page, to talk to their kids. And they're telling us that it's the first good conversation they've had on the issues of drugs, but probably at a deeper level, the issues of who are your friends, who are you hanging out with, and what kind of decisions are you making, and the significance that a single decision can have on your life in a very lasting way. And so we encourage that. We encourage parents to talk not just once and feel like, okay, I've had that conversation, but to talk repeatedly and to start at a very early age. Our goal and our passion is to get this message and this information out to every young person, 5th grade and above, because we feel like you have to start early.
Thank you, Devin and Veronica. And Dr. Bias, we appreciate you both sharing your personal stories and your personal tragedies with us. We are definitely grateful for your efforts around prevention, awareness, and education. We thank you for being with us here today. At this time, we will now go to our Q&A session. Marilyn, we will open up with one question that was submitted during registration, and then we will go to our live participant. One of the questions that was submitted, which is for Dr. Compton, what are the signs to look for that might indicate your child is involved with substances?
Well, thank you. As I was listening to the Eckharts with their such sad story about the loss of their son, and they provided some very helpful information to parents that there are no absolute certain signs, but you look for changes in behavior, so changes in their friendship patterns, so who they're hanging out with. You look for secretive behavior, changes in their grades, changes in their sleep patterns. These are the kind of warning signs that might indicate drug use. It can indicate other things as well, but those are the typical sort of issues that parents may be able to recognize. There can, of course, be physical signs when somebody's intoxicated at the time. But what I'm describing for you are more the long-term changes you may see in their behavior over days or weeks when they're becoming involved in drugs. The intoxication, such clear-cut signs as smelling like something, or you may see changes in their pupil size that are not typical, very large pupils in a bright room or teeny tiny pupils in a dark room, some difficulty with their coordination or balance. Those are the things we look for. And of course, look for missing tablets in your medicine cabinet. And you should make sure that you don't keep psychoactive medicines freely in your medicine cabinet. If you need to have sedatives, stimulants, or painkillers in your home, then keep them carefully guarded. That's a key thing that you can do as family members. And also keep an eye on the liquor cabinet as well. These are signs that can be pretty clear-cut in some households.
Thank you, Dr. Compton. Marilyn, we will now go to live questions. Any questions available?
So let's go to our first caller, the line of Tasharena Horton.
Okay. Yes, my name is Tasha Horton, and I'm from the National Association of State Alcohol and Drug Abuse Directors. I just had a quick question. In the beginning, with the chart of the two brains showing cocaine use and people who don't use cocaine, was the brain that showed cocaine use the effects of long-term use, or is that the brain at that moment you use cocaine?
It's a terrific question. These are examples of long-term use. So those are people who were not using at the time this brain scan was taken. So they're clean and sober, at least over not an extended period, but over a period of time. So these are showing the long-term effects. The acute effects are quite extraordinary and extreme, but that's in some ways that's important because that's the risk for strokes and other really horrible outcomes on the short run. But it's the long-term differences in somebody who has addiction that we were trying to get at with that slide. Thank you.
All right, now let's go on to the line of Lori Ames. Lori, please go ahead.
Great, thank you. My name is Lori Ames, and I'm with a substance abuse and prevention specialist with Catholic Human Services, but also the parent of an opioid-addicted son. One thing I want to just add to the excellent advice about guarding your medications is that when my son was in high school, which is when I started with Vicodin, is that when he was going to parties, I would embarrass him and show up, make sure there were parents there, call, make sure there was going to be parental guidance there, make sure that there wasn't going to be alcohol. But the question of the day, this was back in the 90s, was, are your guns locked? We honestly thought that's what was going to kill our kids, were guns. And what we didn't know was that the actual gun, I guess you could call it, was in the medicine cabinet. And so when you're sending your kids off for sleepovers or play dates, please don't be embarrassed and don't be too shy to ask the homeowner, are your medications locked up? You don't have to ask them, do you have medications? That's not your business, really, but just please, when they go to Grandpa and Grandma's house or sleepovers or any social event, Thanksgiving Day, please make sure that where you're going, that the medications are locked away.
I think that's terrific advice, because it may not be your particular child who's at risk, but for all the people that come in and out of that house, that's a safety issue.
All right, let's go on to our next caller, the line of Cynthia Engel.
Yes,
please go ahead,
yes,
Cynthia.
Can you hear me?
Yes,
okay.
We can hear you.
I'm Cynthia Engel. I'm the grant coordinator for a Cancer Strategic Prevention Framework grant. This was an excellent presentation, and thank you very much for all the participants and everybody involved. Is this film, video, whatever, is this available for task force, anti-drug task force to be shown too? Is this something that will be available for us to acquire?
Yes, hi, this is Jamila with ONDCP. We are recording the webinar. It will be available within the next week or so. We will send that information out as well as the slides when it's available.
That's great. I appreciate that so much, because it really is something I think so many across the board could benefit from watching. And thank you very much for your assistance with this.
This is Wilson Compton. You all are welcome to recycle and reuse my slides. If they'll help you with any public presentations you give, you're more than welcome to any of them.
Oh, thank you very much.
There are no further questions on the queue at this point.
Okay. Thank you, Marilyn. I have a few questions here. I'll just ask one question right now so we can transition to Mary Lou. If we have a few more minutes at the end, we can wrap up with a few more questions. We do have another question that was submitted early during registration, and that will go to our Deputy Director, Mary Lou Leary. How can parents partner with other sectors to maximize input to prevent underage substance use?
Well, I would recommend that parents start by connecting to the currently funded drug-free communities support programs in their own neighborhoods. Through the ONDCP, we are funding 697 community coalitions, and each of those coalitions works with other sectors of the community, like young people, law enforcement, schools, religious media, healthcare, business, and so on. And the goals of these coalitions are to establish and to strengthen community collaboration, ultimately to reduce youth substance use. So if you can look at the DSC webpage, it's at whitehouse.gov/ONDCP/Drug-Free Communities Support Program, and you'll see that later on. You can learn more about this program. But the basic philosophy behind it is that if you have a local problem, you need a local solution. And you know what's going on in your own family, you know what's going on in your own neighborhood and in your own community. You and the other folks from these sectors that I mentioned are in the very best position to design a strategy that will work in your community. Parents have such a powerful voice, and reaching out and joining one of these coalitions or starting one of these coalitions is a great way to maximize the parent voice.
Great. Thank you, Mary Lou. As I mentioned, we are nearing the end of our webinar. At this point, we will have closing remarks from our Deputy Director, Mary Lou Leary. Mary Lou Leary is the Deputy Director for the State, Local, and Tribal Affairs at ONDCP. In her role as Deputy Director, she oversees ONDCP's HIDA program, High Intensity Drug Trafficking Areas program, and the Drug-Free Community Support Grant program. She also oversees the Office's Criminal Justice Portfolio. Please welcome Deputy Director Leary.
Thank you, Jamila. First, I want to thank Director Botticelli, Dr. Compton, and a special thanks to our parents, Dr. Bias and the Eckharts, for sharing their personal stories with us. And thank you also to everybody who participated today. But to our parents who are here with us, you really have taken a personal tragedy and you've made a gift of that to other parents. You've turn it into a positive force to help other families avoid tragedy. So we really are grateful to you. As Director Botticelli mentioned, and I said a couple things, the Drug-Free Community Support Program will help local leaders organize with the goal of identifying the youth drug issues that are unique to their particular communities, and to kind of put together the infrastructure that's needed to prevent and respond to the disease of substance use disorder. Coalitions that receive DFC funds are expected to work with leaders, including parents, within their communities. And the goal is to create sustainable community-level change. There are two other grant programs that support drug prevention. That is the Department of Education's 21st Century Community Learning Center. And they have school climate transformation grants. Both of those two programs support youth during school hours and after school. And we all know how important that is. We encourage everybody on the phone to connect with the 21st Century Learning Center or with a local education agency in your district to see how you can work with them to support drug prevention. You can check out the Education Department's website for more information, www.ed.gov. We can prevent drug use before it starts with programs like this. And for parents, it's up to you to get involved with your local prevention coalition. Next slide, please. You're not alone in this. I just wanted to share a few additional resources with you. We've collected here some links to direct you to guidebooks, infographics, and other resources from ONDCP, from National Institute of Drug Abuse, from the Drug Enforcement Agency, and from the Substance Abuse and Mental Health Services Agency. And you can use any of these resources to help with your prevention efforts. Next slide. SAMHSA has a national registry of evidence-based programs and practices, and that's a searchable online database of interventions for substance use disorders. The ONDCP website at whitehouse.gov/ONDCP highlights federally funded prevention strategies. It also highlights programs, tools, and other resources that may be useful to law enforcement professionals and to community members while they're trying to support or initiate and lead community-based drug prevention. Next slide. Here is yet another page of links to several important and free infographics and fact sheets that we wanted you to be aware of. Please use these materials and share them with other parents, caregivers, and colleagues. Next slide, please. Just as one example, preventing drug use among children and adolescents, this is known as the Red Book, incorporates a set of science-based general principles of effective drug use prevention. And this is coming out of the National Institute of Drug Abuse supported research. And you could tell from listening to Dr. Compton today that science makes sense to people. And when we talk about these things, even with young people, it really registers because it's not kind of you're not coming at it from a moral perspective or, oh, you're a weak person. It's science, and it really does resonate. The DEA also publishes a book called Drug Prevention for Teens. Next slide. So our goal today was to improve your awareness of substance use prevention strategies. Parents, we encourage all of you to become involved with your kids' daily routines, get to know their friends, get to know their pressures. As the director mentioned, October is National Substance Abuse Prevention Month, and we hope that all of you will share our prevention page and flyer with your communities. ONDCP will host a local interactive event on October 27th, 2015 for National Above the Influence Day. And that's to encourage kids to stay above negative influences and to support a friend in need. So we encourage all of you to host an event on that same day and share with us what you're doing on our ONDCP website. Next slide. Thank you so much. We would love to hear from you. And if you have any questions, any comments, please contact Jamila. Her information is on this slide. Thank you again, and all the best in your prevention effort.